right.
Enjoy.
Well, by the way, this is National Public Health Week, and health departments all across the Commonwealth are working hard to keep you well.
We're joined now by Dr. Rice Leach, Commissioner of Health, and we welcome you. Glad to have you in today.
Well, thank you very much. It's a pleasure to be here.
I understand it's a birthday, too, so happy birthday.
75.
Just mention that.
Sounds
and what
great.
a remarkable career you've had in public health. And you have said you would have done nothing else but that because public health is so important. What do you do in Lexington that keeps people better off?
We do all kinds of things like restaurants and communicable disease. The last time I was here, we were talking about Ebola. We have outbreaks of things. We run shelters in case of storms for people that are at home on medications and on respirators need to be someplace but not a hospital. But right now what we're working on is this needle exchange. And the last time I was here, it was Ebola, and you asked me, is that really the biggest problem? And I said, I don't think so. I think it's mental illness, drug abuse, suicide, homicide. And here we have been given by the governor and the General Assembly an opportunity for public health to engage in this drug abuse thing. Now, we're going to start with what we do best, which is communicable disease, and that's needles and hepatitis B, hepatitis C, and HIV. But I think it's going to engage the public health community into trying to approach this from a public health approach as well as a mental illness and substance abuse approach. And I think that's going to make a difference. It'll take a while.
And when you're tackling such a major topic, how can people in the community help you with that?
Well, that's part of the challenge. I mean, we're going to do the needles, but this is a much bigger situation. So we're going to identify people that are working with it, reach out. We're going to continue to do our thing, and in time, I'm sure we'll get engaged to some degree in the Narcan business. But right now, the emergency medical services community in this city is going full bore on that and doing as good a job as they can with what they have. But we need to reach out and get more and more people involved. And being able to talk to you now about this is an opportunity to say, step up, Lexington, give us a hand.
They're supposed to be able to anonymously come in and exchange those needles, but you're saying that is an opportunity for you to at least start a conversation or let them know you're there.
Right, but I've dealt with people that have these conditions in previous jobs, not as commissioner here or Frankfurt, but as a practicing physician in the Indian Health Service and in public hospitals. And a lot of them want help. So when they start to want help, then you've got an opportunity to hand them off to somebody who can do something. And it'll be more than anonymous, I'm sure. I don't know what the state's going to suggest you do in the way of information collection, but we're going to have to show somebody what we're doing, how many we're doing, what's it costing, and how are we handling it. But I think, having dealt, again, with patients with this condition, most of them are pretty decent guys unless they're in the business of peddling this stuff, and they got a habit, and they need some help in getting it managed.
And to keep that conversation going and for people to learn more, they can join you online and get that additional information.
When we get it all worked out, we're in the process. The board's been interested. We've been involved in the task force, and we've had 2 or 3 meetings at work. It's coming together, but we got to get it. We want to do what we do first. We want to do right.
Thanks for being here. We appreciate it very much.